Welcome to the webinar, Learnings from Illinois Community Health Worker Roundtables, Recommendations for the Community Health Worker Certification and Reimbursement Act, which was hosted by the Illinois Community Health Workers Association in collaboration with the Center for Health Law and Policy Innovation of Harvard Law School. We began this webinar with opening remarks from Illinois State Senator Maddie Hunter.
Thank you all for being here and to those who have contributed to the report. Healthcare is a right, and we as legislators and responsible stewards have a responsibility to speak up when we see inequities and act when we see disparities affecting our Black and Brown communities. We have learned a lot from the pandemic and created the healthcare bill as a strategy to reduce healthcare disparities, uplift the community health worker workforce, to increase health equity in our Black and Brown communities. Community health workers are a key force because of their uniqueness and ability to relate to the communities they serve. While the Community Health Worker Reimbursement Act creates a certification process for community health workers in Illinois and establishes a sustainable fund source to support some activities, it has also created a space for Illinois community health workers to be instrumental in the implementation of the law. This was very intentional because as experts and respectable advocates, the Illinois Community Health Worker is the only community health worker association in our state dedicated to unity, growth, and sustainability for the community health worker workforce. This is just a beginning, and we hope to count on your continued engagement with legislators and Illinois community health workers to carry out the recommendations you will hear today. Thank you all for being here and your commitment to this work.
Great. Thank you so much, Senator Hunter, for those really thoughtful remarks and for bearing with us as we sort of swapped around your role a little bit here.
No problem.
Thanks. At this time, I would love to welcome Letitia Boughton-Price and Wandy Hernandez-Gordon to turn on their videos and join me here, and we'll get started. And I'll pass things over to Letitia to give us a little bit of a background on CHW reimbursement in Illinois and how we got to this particular moment.
Yes, thank you so much. Welcome. And thank you, Senator Hunter, and Representative Lilly will be joining us shortly. I'm communicating with her. But anyway, so background. Well, it was kind of odd to reflect on how long ago this process has started, just because of the times that we're living in. So, CHWs have been around for decades doing this work. And back in 2014, there was some CHW legislation that back then it was the Chicago Community Health Workers Local Network, along with membership and other allies, put forth under the Quinn administration, working very closely with the Department of Public Health back then, to establish a board, to establish some recognition as far as the definition and core competencies and skills for community health workers. Well, things happened, pandemic happened, the Legislative Black Caucus then began to travel the state to, figure out the best way to address health inequities as well as disparities within the Black and Brown communities. And so they were hosting town hall meetings, and community health workers came up in that conversation. So through Dr. Ruby Mendenhall and colleagues over at UIC, Ocean, and the Cancer Center, we all began to work together, and some additional membership of ILCHWA began to come together to figure out how we could craft some key points to uplift CHWs in the Legislative Black Caucus push for health equity and diversity in our healthcare system. So here comes the big healthcare bill introduced by the Legislative Black Caucus. Now, there are many, many different points. A part of this bill is very historical, and Community Health Workers Reimbursement Act was also included in that piece. So you know, it didn't just happen magically. It was just good timing again for the community health worker workforce to be illuminated and lifted in this time. So that is kind of like the background of how community health workers got into this historical legislation introduced by the Legislative Black Caucus. And so because in 2020, that's when all of this started happening, it got signed into law, and 2021, and it's been over a year. I can't believe it, but we're here today. And so now, because it was signed into law, we had to figure out how we're going to implement the piece around community health workers. And the two biggest points around the community health worker piece was the Medicaid billing piece through HFS, identifying some key activities that could be potentially reimbursed for community health workers, but then also the certification piece, which identifies, you know, a certification process by which community health workers can be certified in the state of Illinois and get reimbursed for some activities. We have worked very diligently with our membership, with the Legislative Black Caucus, with the Department of Public Health, with our governor's office to try to, you know, ensure that this process is inclusive, that it will not hurt or hinder current efforts, that we come up with a certification process and billable activities that are really important to us here in Illinois. So what we did was get an opportunity through UIC to work closely with Harvard, and what a blessing that was, to try to put together, you know, just create a space so that we can get input to figure out what people are thinking, what they would like to see move forward around this certification and reimbursement of community health workers in Illinois. So with CHWs support and collaboration, we formulated a process to just have some roundtable discussions with different key folk to just try to gather some input, because again, we were really aiming to have this report as a foundational piece to assist the certification board as we begin to lay out the certification process for community health workers here in Illinois. So we wanted to kind of start small, but make sure that we have representation from across the state of Illinois in different sectors, right? So payers, providers, trainers, the community health worker workforce themselves in English and in Spanish, and then just like a catch-all discussion. So we had about 5 discussions. We also created a survey piece to ensure that we could still capture as much information as possible. And here we are today, reporting out the findings from those robust conversations. And with that, I'm going to pass it over to Wandy.
All right, thank you so much, Leticia. All righty, so Letty was able to actually provide us with who was involved in these roundtables discussions. And so now I'm going to talk a little bit more in depth in terms of, you know, the findings of the training roundtable discussions. So thank you so much. Some of the recommendations of the training. Stakeholders spoke highly of the Community Health Worker Core Consensus Project, C3. There was also a wide array of additional subject area competencies or soft skill sets that were very important, as well as some variability on which were most relevant. So as you guys can see here, there was a lot of things that were actually spoken about, that training opportunities should not require a peculiar level of formal education, such as a high school diploma or GED. As you know, we do know that some of our CHWs have had trauma in the past with going to school, and so they actually learn best by actually doing. And they have been doing, right? A lot of CHWs do the work. They just need to actually, they already have that core skill of what is a CHW, even though they don't know it. They actually are street smart in how they actually perform the education and promotion of providing these type of services. And they actually are able to do a variety of things. So, a lot of them actually talked about how, it doesn't take, an ED or high school diploma or any type of, a big, equivalency to be able to do this work. You have to be, as we've always called it, street smart in order for you to be able to understand what the community is dealing with. And be able to relate to the community, to be able to provide the information in a way that the community is able to culturally understand and be able to digest, as well as be able to actually, get it done, right? So, and that is a unique skill that is not taught. A lot of these CHWs come with this unique skill, and a lot of, facilitators and community, a lot of, like I said earlier, facilitators and professors are like, so how do we actually, that is a unique skill. How do we actually teach that? And that is something that, we're still having conversations, for a very long time until this day. The other thing I wanted to highlight here is training programs should include an explorational learning component. A lot of CHWs were talking about, that experiential learning is through, through real life experiences, reflecting on it, practicing on it, doing the work. And some of these CHWs were also talking about like wanting to make sure that, that they themselves, since they were, some of the CHWs that we had in our roundtables are also leads of community, that they were also willing to actually be mentors and guiders of this process, and that they wanted to make sure that they, would be involved in this type of work. The other thing that came about was the language of the training, that materials should not be written, that some of the materials not written enough in different languages, or when they are also translated, that the quality of the translation may impact trainees' ability to learn. So a lot of this was actually an issue. The cost of the training itself, the opportunity of cost of training rather than paid work. And the other thing that they actually spoke of was, that it's really important for them to be able to, have different types of advancements of the work, right? That, there should be like a level, CHW1, CHW2, etc. Because a lot of them were talking about that there should be a basic and actually tiers, and being able to, learn different types of competencies, advanced competencies, trainings that, that they felt like they needed to be able to execute some of the things that their communities were dealing with. And that's something that they really didn't have. And so that was, something that they actually talked about. The other thing that they actually talked about was, training programs should not require a citizenship or legal residency requirement. Now, as what Leticia was stating, we want everyone to be on board, right? We really don't want to hinder anyone's, anyone that has actually taken prior trainings before. We know that a lot of federally qualified health centers or different agencies, right, varieties of agencies, faith-based, are already doing this. They've been doing this. There's one in particular that I've known for a very long time that has 100 years of service, which is Marillac House. And so those are the people that have been doing the work and have CHWs, which, they're really not called CHWs, right? Because we have over 250 titles under the CHW umbrella. So that is something that we also need to actually think about as we're actually doing this type of work. The other thing was, let me see here. Experienced CHWs must represent among leadership of all certified training programs, which I actually talked about. So we really, there are a lot of CHWs that already have a lot of certifications underneath their belt. And so, that's something that they want, to be recognized with. Certified CHWs must be given opportunities to learn new skills through continuing education. We talked about that already. It doesn't stop after they actually do, these type of trainings. There's other things that come up as what we've been experiencing, the pandemic, right? It has been mutating. CHWs want to know about that. Monkeypox. Then, so there's a lot of things that are going on, as well as social determinants of health, because that actually embeds everything that has to do with how we actually provide the service, what do we see in our communities, and how we able to kind of provide resources and be able to advocate for the communities that we serve. So that is something that's very, important and needed. Let me see here. And one thing else that I wanted to talk about was there's different ways to be able to actually evaluate a CHW, right? They were talking about that, that shouldn't really be a written exam all the time. There should be like an oral, it should be like like an oral exam of some sort that they can actually be talking about what they learned. Or role plays, a lot, if you want to know how they're actually, what they learned, you can actually look at how they're doing it and, stuff like that, instead of it always having to be an exam type of thing. There's other ways to evaluate these type of trainings. And that was something that CHWs talked about, that, they wanted to make sure that there was different avenues of being able to demonstrate that they knew how to do things, And again, it comes back to the trauma situation, ladies and gentlemen. It's really important for us to, if we really want to train the right people, we need to make sure that these trainings that we're providing are for CHWs and led by CHWs. Now, a lot of these, the CHWs also talked about being a part of the process, wanting to actually, again, be mentors of the process. If there was CHWs that were recently starting that had the core, that they would actually mentor them, guide them a little bit more towards what they had to do. There was also discussion about CHWs wanting to be a part of actually developing curricula. That why, that it's very important for them to be included in this type of work. They're already doing the work. Why weren't they included? They can actually provide so much information and insight in terms of really what is needed to be able to actually, assist the CHW to do the best work that they know how to do and can do, right? And so, yeah, it's really important for us to really overall see that these type of things are very important and, and actually be able to, provide this type of training in the language that they actually need it to be provided, and culturally as well, because, CHWs, as we know, they come from different cultures, different ages, walks of life. And so, the smallest one that we have in our membership is 12, and the oldest one that we have, she's 88. So if we can actually provide some type of training that actually captures what these CHWs versus if they're young or elder do in training, that would actually even, it would intensify and make the training even more worthwhile. And so please, it's really important. And the reason I'm actually pushing for this is because, these, when we were talking in the roundtable discussions, they were like, Wandy, please stress the importance of this, you know. So I'm really, you know, I'm trying to do my best. So if you guys are out there, I'm hoping I'm doing the best that I can. But yes, please make sure that, you know, CHWs are actually at the table assisting in developing, you know, criteria, curricula, and being able to be mentors in this work, because that's what they really want to do. So with that, I'm actually going to pass it along to Erin to provide a little bit more insight on what I was actually talking about. Thank you.
Thank you so much, Wandy. And that is certainly a tough sort of piece of information to follow. I think, as Wandy already articulated, the training section of these roundtables was where a lot of our CHWs and training organizations and employers had a lot of really passionate thoughts about sort of the way that the training should go. And as Wandy mentioned, some of the sort of key themes that were running through all of that discussion was really ensuring that the training programs that we're relying on in the state to produce CHWs that can go on to certification, that those training programs accomplish a couple of things. So first of all, we want those programs to be something that sort of allows people who are already working as CHWs or already prepared to do that work to really hone some key sort of core competency skills, as well as providing opportunities beyond those core competencies. So being able to specialize in a particular subject area of CHW work, or as Wandy mentioned, being able to sort of advance skills, develop additional trainings on sort of in advanced ways to be able to supervise or do additional tasks. At the same time, we really want to make sure that these training programs don't create or iterate on barriers to education that CHWs may have already experienced. So it's a difficult line for these training programs to navigate, and a question that might come up is sort of what can the state do to help training programs navigate this and really set everyone in this sort of whole educational spectrum up for success. So what I wanted to highlight here really quickly is sort of an example of how another state has done that. So here I want to point to the state of Oregon uses their regulations from their Oregon Health Authority to sort of outline the way that their CHW training goes, with then the sort of next step after that being Medicaid reimbursement for those trained CHWs. And the reason that I want to highlight it is a couple of key sort of areas of their regulations. The first is that the way that the Oregon Health Authority developed their curriculum. So there they have sort of a core program with certain competencies, a minimum number of hours, and then you can sort of add on additional competency areas based on a specialty. So at the core, every CHW that receives certified training in Oregon receives training in community engagement and relationship building, identifying community resources, cross-cultural relationships and cultural humility, including bridging sort of communication gaps between the healthcare and community cultures, systems navigation, self-care for CHWs and the folks that they serve, as well as a background in trauma-informed care. And those are some of the sort of key provisions that the state of Oregon decided was key for all of their CHWs across specialty areas. But there's also additional specialty qualifications based on a particular subject area that a CHW is working in. The other thing that the state of Oregon does in their regulations is really affirm that commitment to reducing training barriers and centering CHWs in that training process. So every training institution that is certified by the state of Oregon to train CHWs has to have demonstrated efforts to establish equivalencies for outside training. So CHWs coming in from a different state or through a different educational system, there's got to be some sort of equivalency system where the training that they already have counts for something when they're moving to the state of Oregon. Training programs are also required to have CHWs involved in developing and teaching their core curriculum, which was something that we heard from our trainers as being really important. They also require that there be a method for students to give feedback on their educational experience. And the programs need to demonstrate efforts to make training inclusive and remove those barriers to access. And this is something that these training programs need to do when they seek certification, and also in a renewal process every 3 years have to update the state to confirm, yes, there are still CHWs involved in developing our curriculum. Yes, we still have these equivalencies. So that's just sort of one example of ways that states could be really intentional in including CHWs on all levels of the training process. I do want to be mindful of our time here, so we'll move on to our roundtable discussions on certification next. Before we do that, I do want to give a quick reminder again that if you have any questions, you can pop them into the Q&A box, and we'll have about 15 minutes at the end of the webinar to get to those. And next, I will pass things back to Wandy to discuss certification.
All right, thank you, Erin. So in regards to certification, there, a lot of the participants that actually joined this discussion talked about the importance of multiple pathways of certification, right? That as I talked to you all about, that there's a whole bunch of CHWs that have 15 or 10, 15, 20, 30, 40 years of experience underneath their belt, and they have an array of different certifications. And so they really want to make sure that those are accepted. And so, we talked about, grandparenting protocols for experienced CHWs, in terms of how would that, what would those be? And then ways to consider and the amount of value of lived experience, because as I said, a lot of these CHWs are already doing the work. I started at the age of 9, assisting my grandmother and my grandfather in translating, some information that they needed, to a public health department. So, we start very young in doing these things. In doing this type of work. So, once I actually started to do that type of work, a lot of, our neighbors saw that, that was something that, a lot of them needed. And so I would assist them in doing that work, to be the translator, to be able to actually look at documents and be able to read it and translate it to them in Spanish. And so, that was something that, a lot of us already have embedded in us, is ingrained in the type of work that, that we've been doing already. So lived experience, once again, is very important. And multiple assessments of tools. And this goes back to the experiential learning of how, how to do that, right? And so, again, I said there's different methods of doing that, not only written, there's shadowing, being a mentor, visual stuff, they can actually, assess and doing role play scenarios, whatever the case may be. But there's other ways and forms to evaluate how well they're doing, and providing them the tools that they need to be able to actually do a good job, when, obtaining certification. So, I talked about certification must be low or at no cost to a CHW. That was also very important for them, because as many of them are also, they are, they live in the communities that are being provided the service. So it's really hard for them to be able to, be able to pay for this type of work out of pocket. And we talked about different languages, to be able to provide certification. It shouldn't just be in Spanish. There's other languages that a lot of folks actually speak. And so we need to actually make sure that we tailor this type of certification accordingly to those CHWs. The other thing that we talked about was, let me see here. Stakeholders from across the CHW community should have meaningful input into accreditation determination. Yes, it's really important, that they are actually able to assess really what's going on. Because as we actually implement curricula, things do evolve in our community. Social determinants of health evolves. The health of it all, what we actually learn is not the same. And so it's really important for us to continue to actually be able to provide CHWs with array of different types of skills so that they can actually feel comfortable and confident to be able to actually promote and educate and lift CHWs when they're doing their work. The other thing was certification processes credit CHWs for their experience. We talked about that as well. Implementation of statewide certification through grandparent. I talked about that already. Yeah, so a lot of these things, I already actually mentioned. Again, I just want to emphasize, the necessity of soft skills associated with CHW profession, because like I stated earlier, these things are about being street smart in the community that you live. A lot of these things can't be taught. And so it's really important that, we're able to understand what that is, the core of it all. Yes, we can infuse it with other content, but there is a core. And, not everyone can be CHW. It's not a 9-to-5 job. It's a 7-day, 24-hour, type of thing. You have to, when you tell your community, hey, I'm here for you, your phone is, that's the way they actually reach out to you. You provide them with your cell phone number and they're able to call you whenever they need, something. And so that's something that, a lot of people don't understand in terms of this work. The other thing, let me see here real quick. Certification materials must offer, yeah, I talked about that already. So there's a lot of things that I actually talked about earlier on. I'm so sorry, Erin. I got too emotional here, No. I talk, me. Yeah, so yeah, it's just, overall, and once again, we really don't want to exclude anyone from this process, because a lot of CHWs that I have spoken to, they're really concerned, about, I'm undocumented. I don't, I can't. So how, will this hinder my, my progression? And I really, and it's really important for us to be able to make sure that it doesn't. We do have some CHWs out there that, are, as I stated earlier, that are 88 and they're doing this work because they love to, and they don't need any certification attached. But there are some CHWs that have been doing it for decades, or even since when they were a child, like myself, that really would like to actually have something as a profession, that they can actually, why not? Why not have something that actually you love to do and you're passionate because you actually have your heart in your sleeves and you're constantly doing the work. So why not have this as a profession? And we want it to be respected. And we want it to actually have some integrity involved, because like I stated earlier, not everyone can be a CHW. You can actually get trained, but if you don't have that street smart, that off, it's really hard. It's a challenge. And for those of you that are seeing me and understand what I'm saying, once again, I'm hoping that I'm actually representing you well. And for those that need a little bit more information in terms of what's that talk to me later. I'll give you that information later. So once again, I'm going to pass it along to Erin for a little bit more information. Thank you.
Thank you, Wendy. So as Wendy mentioned the importance of this certification process, well, I was about to say twofold, but it's really more than that. But sort of two of the key points of why the certification process is important with regards to this bill was, as Wendy mentioned, the certification is really an opportunity for CHWs to specialize, to make this a career, to have a trajectory within this profession that sort of comes along with that sort of certain amount of authority. And in addition to that, with the way that this bill is structured, in terms of Medicaid reimbursement for CHW services, CHWs need to be certified to be reimbursed through Medicaid under this act. So as Wendy, I think, brought up a really good point there, that, not all CHWs have to be certified. It's not something that they necessarily have to pursue the certification process, but for CHWs who are hoping to have their work reimbursed through this particular pathway, that certification process is going to be necessary. And if we're thinking about what we really want the certification process to achieve, it's to really equip the community with the best CHWs that are out there already doing this work. So when states are thinking about how to create a certification process that accomplishes that goal, that sort of elevates the best CHWs to this new position, it's important to be really flexible and creative with the way that that certification process is designed, and do that in a way that is, of the community, taking these recommendations from community health workers and the folks that they serve into account. A couple of quick examples of some of the different kind of styles of certification process that other states have pursued, just to give folks an idea of what Illinois could do. In Rhode Island, their state plan amendment for certification creates a sort of holistic process of application for certification for CHWs. So rather than saying a CHW must complete this particular program, it's a certain number of hours of paid or volunteer work, a certain number of hours of closely supervised work that's being evaluated, a particular number of hours of education, but a little bit more flexible about what program that is, and then a sort of holistic portfolio of accomplishments that each CHW submits. So if folks have, skills or attributes that they don't feel are represented in those more sort of education and work requirement pieces, that's an opportunity to bring those skills in as well. In some other states where there is a little bit more of a strict certification process, they've been able to introduce multiple pathways to accomplish that certification process. So in Oregon, under their regulations, there is a state-approved training program and application for certification that all CHWs have to go through. But there's also a reciprocity program for training that is done elsewhere to apply that towards your Oregon certification. And there's also what they call a legacy clause, which is an option for experienced CHWs who have already done the work, who have been in the field for a long time, to be able to sort of skip certain parts of that certification process, along with recommendations from employers and community members. So one of the recommendations that we have here is that if a state decides that they do need to be a little bit more stringent and strict about what these sort of nuts and bolts requirements of certification are, that they build in that flexibility for experienced CHWs who have already been doing this work through a legacy clause, through grandparenting protocols, or through a runway where, say, an experienced CHW who is actively pursuing their certification has a certain number of months within which they can continue working as a CHW while they pursue that certification. In the interest of time here, we are going to have to keep on moving. Next, we'll bring in Letitia Boughton-Price to talk us through some of our discussions on Medicaid reimbursement. And again, a friendly reminder that if you do have any questions, you can pop them into the Q&A.
Thanks, Erin. And this legislation definitely helped us get a little bit further along in this reimbursement conversation. But here were some key points related to the reimbursement. And again, you all will get a copy of the full detailed report. And so you can see all of this information in a more detailed format after the webinar today. But definitely, it was suggested that technical assistance be provided to CHWs and employer organizations to support the infrastructure development and partner building with healthcare entities. It was also suggested that IDPH should develop a category of enrolled medical program provider that would allow experienced certified CHWs to act as supervisors. So we still have more work to do here. Billable services, these were just some additional categories added. And they also emphasize a billing system that is structured in a manner that reimburses CHWs for the services they provide without unduly restricting the flexibility of their work. For example, maybe the reimbursement structure is billable for a 10-minute encounter, but as you can see, CHWs love to talk, and a major part of our job is to build relationship. So while we have in our mind the goal of that encounter, you know how it is when dealing with other people and humans, like their priorities tend to come first. So instead of just ignoring what they would like to talk about, we still want to be able to get credited for that the building relationship part of that encounter, but ensure that we get to the point of that visit, right? So just be a little bit more flexible when it comes to those billable accounts. And then finally, recognizing that not all CHWs will be eligible to receive the Medicaid reimbursement, and not all Illinoisans who need CHW services are eligible for Medicaid. So Medicaid reimbursement must supplement, but not supplant, other sources of funding for CHW services. So we've had, our champion foundations, those one-time grant supports that have been coming around, and we don't want to have those supports fade away, because we, as we can see right now, we're still need to work on, just a sustainable strategy in this healthcare reimbursement. The CHW Reimbursement Act with the HFS Medicaid reimbursement is just a nice step in the right direction, but it's not the solution to everything, because not all activities are documented or supported there, and then not all the CHW work and people who are people just won't have access to that. So we don't want to, think or have our other funding sources think that because, Medicaid has signed on to this and they agreed to this, that we don't need you anymore. We need everybody still to this day, until we get to a place where CHWs are fully sustainable and have livable and equitable wages, and their efforts are being accounted for. And I think we still have a few more years till that takes place. So we still need all of our current actors to stay involved and engaged. And but we're definitely in a better place than we were, 2-3 years ago. And we appreciate that. So Erin, I'm gonna turn it back over to you. Thank you.
Thanks, Letitia. And one of the points that Letitia brought up here that I do really want to reiterate and highlight is particularly when we're thinking about Medicaid reimbursement and that sort of portion of this bill, the moment that Illinois is in right now in this implementation section is really an opportunity to build a strong foundation to really get this right as the implementation is starting. And one of the things that Letitia mentioned there that's worth highlighting is the opportunity to really do some sort of learning and education around the reimbursement process as Illinois is sort of building it up. So CHW organizations, community-based organizations are going to be entering into a new type of partnership with Medicaid as CHWs are seeking Medicaid reimbursement. And that's going to come with a lot of sort of new technology, new infrastructure, new ways of dealing in this sort of contracting partnership that community-based organizations might not have had to consider before and might not have the capacity to do right away. And where the state can really support this process is in providing assistance in sort of gearing up to be ready to become good partners to Medicaid. And one example of a way that another state has done that is here in Massachusetts, when Mass Health started its flexible services program, which incentivized accountable care organizations within our sort of state's healthcare to partner with social service organizations to target health-related social needs. So there was a big push within Mass Health to have healthcare organizations partnering with community-based organizations to provide food support, housing support, and that suddenly turns this big spotlight on these community-based organizations that have not had to consider this type of partnership before. And they've got this sort of big push from healthcare to be referring over, and a big sort of influx of folks that they need to provide services for. And one of the ways that Massachusetts was able to set those community-based organizations up for success in helping the community in this more robust way was with the SSO Preparation Fund. So the Department of Public Health here in Massachusetts established a pool of funding that was specifically for organizations who needed to update their technology, their data exchange, their business practices, or sort of other areas of the way that they do things in order to be good partners to our Medicaid program. So as this Medicaid reimbursement process is coming in Illinois, we would encourage the state to think about the ways that they can really bolster this new partnership and set it up for success. If Wandi and Letitia would like to join me again, I think that we are going to be able to move over to our Q&A section here. Let's break those down. All right, our first question is, thank you, Wandi, you rock, and you do. So we've got a question here. Are there things that other states have done that we're concerned could be would limit or create barriers for CHWs in Illinois? So I know, Wandi, you spoke a little bit during training and certification about some of the things that folks at our roundtables had identified as barriers in training and certification. And I think that is some of those things, just to reiterate, are educational requirements, citizenship requirements, background checks on returning citizens was another thing that some folks had highlighted. I think we want to be able to have CHWs who are able to connect with returning citizens, folks who have been previously incarcerated, and background checks could be a barrier to that if not done in a very intentional way. I think, so using that one as an example, I think one of the ways in which some states have set up these processes in a way that could be a deterrent to CHWs is just by sort of going for the standard version of something without recognizing that CHWs are a really specialized and unique workforce. And I'll take background checks as an example of that, just to sort of say what you mean. If a state certification process has a background check and they just sort of throw in background check without being really intentional about, what sort of things within a background check might actually mean that somebody shouldn't be a CHW versus if somebody has a criminal record, what maybe it doesn't affect their ability to be a CHW as much. So being really intentional about what would actually impact somebody's ability to perform effectively as a CHW. And then also, if a state is more narrowly tailoring that background check, what are they doing to communicate the fact that it is a narrowly tailored background check effectively? Because there could be somebody who is an otherwise qualified CHW who just sees background check on the certification and says, well, I guess this can't be for me. So being able to both be intentional about the ways that we're implementing these things and also articulating that, providing that education to the community. Wandi and Letitia, do you have anything else there to add?
Yeah, I just wanted to say that, I'm so glad you actually lift that concern up, because we do have some CHWs that, have been involved or used to be involved in gang-related activities. And so they know the ins and outs, and they're able to not only help the community, but also help the police department understand what's going on, if there's any rivalry coming up. I know that in Illinois, we had this program that it utilized a lot of those CHWs that were able to educate the police department as well as the community at large and letting them know what was going on. And so, those are the folks that we're talking about, right? It's really important because a lot of CHWs come in this work because of the lived experience that they have, whether it's, something traumatic that has happened in their life or something good that they want to continue to actually provide to their community. And so, through that, we should be able to be, as you stated, Erin, very, very thinking about, how this will be actually implemented, and what, yeah, let's just, I'm going to leave it there because I have a lot to say, but I'm going to leave it. Go ahead, Letty.
Yeah, I would just add that the supervision in other states have come up where some states have stated that, you know, a physician has to supervise a CHW or a nurse has to supervise a CHW, and not really lifted up CHW supervising, you know, the workforce. I really, and I know I may get in some trouble because I'm not mentioning like a lot of our partners and members membership, but one you know, structure that I want to uplift is what our colleagues are doing over at Sinai Urban Health Institute. I remember back in the day, they didn't have a structure, and then they worked very closely with their HR development, HR department to do like CHWs 1 and 2s and 3s, and you know, just kind of work through their system to kind of create a pathway for their CHWs. And I think that, you know, it's not understood that CHWs is this unique workforce. And so people oftentimes try to put CHWs in a box based on their experiences, based on the traditional way that our educational systems go and things of that sort. And so we just have to challenge that way of thinking, come into the space with an open mind, because the end result is healthy communities that have access and equitable resources and services to make them a, you know, well, healthy community, right? Everybody in the end, that's what we want. And just, you know, be open to that. That's the one thing that stood out to me. And I think you all kind of touched on the backgrounds and stuff like that. So that was the other thing in the other space. Oh, and then just involving community health workers in the process. So there have been states that have taken it upon themselves, whatever that particular workforce is, whatever that entity was, organization was, to kind of create, you know, things to kind of around the CHW workforce, but CHWs were not brought into the process until later down the line. So here in Illinois, I applaud what we're doing and the struggle to ensure that CHWs and organizations like ILCHWA, who have a mission and a focus on the CHW workforce, be included in a process that will dictate the future of our workforce. So we're doing an excellent job at that. Of course, you know, it took us a minute to get here, but we are happy that we are on the right track. So just ensuring that any matters related to the community health worker workforce, the CHWs have a say, have a place at the table.
Thank you so much, Letitia. And I think that touches on another one of the questions that is in our chat here. So I'll just read off the question, and then if you have anything additional to add there, please do. With the listing sessions, was there any sentiment from CHWs that the workforce would lose certain qualities in the implementation process of the bill, potentially things for state advocates to consider in future coalition work? Letitia, I see you nodding your head. You want to take it?
Yeah, I'll take the first pass at this. So I think what I'm hearing here is what kind of lessons learned can we share based on our process that would, you know, ensure engagement of, you know, key actors in the process. Would you say that's pretty much what the question is asking?
I think that is sort of one piece of it. A little bit of what I sort of read in the question is kind of that concern of, as we're putting CHWs through a more rigorous, you know, certification, Medicaid partnership, is there concern that any of the sort of like the real magic of CHWs is going to get sort of squeezed out as it goes through this more formal process?
Right. So we've oftentimes referenced some of the disapproval from the CHWs around professionalizing the workforce. So we do understand that that is a risk that we are going to take in, elevating the workforce in a way that state entities, others recognize the workforce, which would overshadow the essence of the work, right? Because as Wandi mentioned, and as we talked about earlier, some of the skill sets that's needed to do this work is not taught in the classroom. You're either born with it or not. And so we do understand the essence of community health worker. It's really this deep concern, this unique connection that you have with your communities to help them get the resources, to help them just be able to live and grow with no barriers, obstacles in the way, right? We understand that. So just to be truthful, we do understand that that is the potential risk of this professionalizing. But we want to assure you 100%, Wandi and I will go down fighting.
Yes, we will. Yes, we
Go
will.
down fighting to ensure that no one gets left out of this process. And we will fight to keep the essence of the work as the core foundation to what we're trying to do here in Illinois. So I hope that provides some comfort.
Right, and we may also, if I may, we may need our members' assistance in doing that. So if you're not a member of ICHWA, please do so, because a lot of this information, as it actually unfolds, will be placed on the website. And, we really want you all to actually review it. And if you have any questions, please let us know, because that's what we're here for. We're here to actually advocate for you guys. We're here to listen to you guys, and we're here to promote the integrity of really what is a CHW.
Awesome, thank you so much. So we'll just with the last couple minutes here, I want to, Wandi and Letitia, give you a moment to do any sort of brief wrap up, ultimate takeaways from this report and what we hope it will achieve.
All right, so I just want to say a couple. Obviously, flexibility is vital to this process, as we've actually talked about. Multiple pathways in pursuing our ultimate goals is very important. And being, as what Letitia and I have mentioned several times, all-inclusive, not leaving anyone out of this process. And capacity, building and educating during implementation as the process actually occurs. And as IDPH develops regulations, there will be opportunities to comment, so please do so. What else, Letty?
Just to reiterate, these recommendations from this report was not generated just from me and Wandi and Erin and Marianne in our, Zoom living rooms, just like, oh yeah, we should do this. No, we actively sought out participation from different folk around the state of Illinois, which included payers, providers, CHWs in both English and in Spanish, trainers, educators, and then we just did a catch-all. People that we thought we missed from different racial, ethnic backgrounds, and others. So we definitely sought out participation, and you all will get details on that information when you get the link to the report. So we're just, we looked for continued engagement and feedback from our membership and others to try to get a nice, start, a foundational piece for our implementation of the CHW Reimbursement Act. So just wanted to close on that as far as key takeaways.
Awesome. Thank you so much, Letitia. And just to add on to Letitia's point there, that, you know, this was a process that was about community engagement, about developing recommendations that are of this community. And it's a really great first step, but it's a first step. So we're really encouraging the state to continue in an ongoing collaboration that includes consistent engagement with the CHW community at all levels throughout this process and beyond. And with that, I would like to turn things back over to Marianne, please.
Thank you so much, Erin, Wandy, and Letitia. To provide some concluding remarks, we'd like to welcome State Representative Camille Lilly. Representative Lilly was born and raised in the 78th Illinois House District and spent her professional career advocating for and working diligently towards economic opportunity, community development, health and wellness, and educational advancement for her district residents. She graduated from Oak Park River Forest High School before pursuing a bachelor's degree in management from Drake University, a master's degree in healthcare administration from Oklahoma University, and an executive MBA from Northwestern University's Kellogg School of Management. She serves on the board of Westside Health Authority, Loretto Hospital Foundation, Columbus Park Advisory Council, and Chicago Park District. Representative Lilly, thank you for joining us.
Thank you. Thank you for that kind introduction. As we close off, I would say a most powerful first step as we address the health outcomes here in the state of Illinois. I just truly appreciate being included along with Senator Hunter, as we are just champions of the work that you all have been doing for decades. I appreciate all who are in the process, communities, legislators, providers. You all are important to this process. What an honor to be a part of such an historical legislation here in Illinois when we passed HB 158. And working alongside ILSTRA, its leadership and its membership, along with, I'm very excited to see Harvard University at the table to be a partner in making sure all, I'm going to say all Illinoisans and all Americans have better access to healthcare. You see in the recommendation, the report, that they laid out recommendations to assist the Illinois Community Health Workers Certified Board, Certification Board, and is creating a process that is fair and equitable to all of the CHW workers. This is a statewide recognition, and we are looking to elevate the role of the community health worker, and as you guys know, it's CHWs, in our public healthcare workforce setting. As we all have been a witness over the past couple of years, it's taken all of us, every single one of us in public health system to go through and we're not quite out of it, but to do the best we can to overcome the pandemic of COVID-19. The community health workers has helped our communities in this effort, and they have provided to all person in need information, resources, support. They have advocated as they navigated, help individuals navigate their own personal challenges. We hope this act, HB 158, will be the first step in making sure that the recommendations that are presented are inclusive and collaborative, and that ILTRA and all of his decision makers here in the state of Illinois working together to create equity and diversity in our public health system, in our healthcare system, and our state overall. This is the foundation of the bill that we created, meaning Senator Hunter and I. And we are basing all of this work and information on the need to make sure everyone has access to healthcare, so that they will have quality life here in Illinois, and they can live with dignity. And you do that when you have persons working together, entities working together, focused on making sure that we are staying on track to encourage all entities to support health and wellness. I am encouraged and I am excited to continue to work alongside my colleagues, the state agency, the governor's office, and all other entities here in the state of Illinois to support what we're doing on behalf of the community health workers. And the way Senator Hunter and I are going to do that is stay on top of everything that is being set forth here in this particular report, also what we have set forth in the legislation. And we call that follow up and follow through. And when we do that alongside many of you. So I really, truly appreciate being a part of today's discussion. I learned more about, and certain things were explained, even more so, that allows me to make sure to feel confident that ILTRA and its mission and our mission to strive to make sure equity and diversity in our healthcare system and our workforce here in Illinois will be accomplished. Again, thank you all for your involvement. Thank you for being here today. And I look forward to the work that is in front of us. And as mentioned, it's only our first step, but it's a great first step. So thank you all.
Thank you so much, Representative Lilly and Senator Hunter, for joining us. Thank you again to our panelists, Erin, Letitia, and Wandy. Thank you to everyone who joined us today, especially those of you who also participated in the roundtables. We really appreciate everyone's work and dedication to ensuring that this law is implemented in a way that supports a sustainable, diverse workforce. For questions about the report or how to join ILTWA, please email iltwa2018@gmail.com, and that information can also be found at the end of the report. Special thanks to the advocates and organizations that have led and continue to lead efforts to support the community health worker workforce in Illinois, and special thanks to Bristol Myers Squibb Foundation for supporting this work. This concludes our webinar. A recording will be made available for those who would like to refer back to it. And we would like to wish everyone a great rest of the day. Thank you so much.
Thank you.